Hello everyone, welcome to the final part of First Aid for Medical Emergencies. In this part we'll be covering burns and seizures. There are three types of burns: first degree, second degree, and third degree burn. First degree burns only damage the outer layer of the skin, causing redness and swelling. Second degree burns damage the outer and the underlid layer of the skin. Blisters will appear on this type of burn. And finally, third degree burns destroys the deepest layer of skin, causing a damage to the nerves. This is the most dangerous type of burns. It can lead to infections and in some cases death. Treatment for burns depends on the cause of the burn, how deep it is, and how much of the body it covers. Antibiotic creams can prevent or treat infections. The longer the burning goes on, the more severe the injury. Your priority as a first aid provider is to cool the burn as quickly as possible. Management of burns. Start cooling the burn as quickly as possible. Hold it under cool running water for at least 10 minutes or until the pain feels better. If there is no water available, you could use cold milk. Remove any jewelry or clothing, unless stuck to the burn, before the area begins to swell. When the burn has cooled, cover the area loosely with a cling wrap or plastic wrap. In order to protect the blistered area, cover the area with a sterile gauze bandage. Use a non-stick dressing if available and wrap the bandage loosely so it won't stick to burned area, to the burned skin. Do not break any blisters, as this may cause infection. Monitor the patient and seek medical advice. True or false? Putting toothpaste on burns may cause more damage to the skin and underlying tissues. True. Do not apply a toothpaste to the burn, as this may cause an infection. Toothpaste can damage your skin and introduce bacteria. Seizures. In adults, the most common cause of a seizure is epilepsy. However, it can be caused by other things, including a head injury, alcohol poisoning, lack of oxygen, or low blood glucose. Epilepsy is a condition that affects the brain and can cause repeated seizures, which are often sudden and dramatic. Common signs and symptoms of seizures include confusion, aura, sudden falls, staring, uncontrollable jerky movements, strange sensation and emotions, and loss of consciousness or awareness. True or false? If someone is having a seizure, put something in their mouth so they don't swallow their tongue. False. Never put anything in someone's mouth during a seizure, as he may swallow it, causing suffocation. Your priority is to keep him safe until professional medical help arrives. Management of seizures. With any seizure, it is important to first protect the person from harming himself. Ask any bystanders to stand back and clear away any potentially dangerous objects. Make a note of the time that the seizure started. Do not try to hold or restrain the patient, and do not put anything in the patient's mouth. Protect the head. You could place soft padding underneath it, such as pillow or a towel. Once the patient stops shaking, open the airway and check the breathing. If he is normally breathing, then put him in the recovery position. Monitor the level of response and make a note of how long the seizure lasted. Bear in mind that if the seizure continues for more than 5 minutes or the person is unresponsive for more than 10 minutes, immediate help is needed. Call for help if needed. Minutes could make a difference. Hope you've enjoyed this presentation and thank you for watching.